Hospital consultants are set to take industrial action. Tell us more about that.
Yeah, that's right. Senior doctors in England, Mark, these medical consultants will strike on the 20th and 21st of July next month. These are members of the British Medical Association, as I say, affecting consultants who are members of that union and working within England. 86% of their membership voted yes. They had a 71% turnout, so that's more than 24,000 of their consultants voted in the BMA's ballot. Effectively, this is going to be a 48-hour walkout affecting routine services, but we understand that emergency care will be covered. But this is, as I say, planned strike action. It will result in so-called Christmas Day services. What does that mean? There won't be any routine surgery or appointments. And let's remember, this will come now, these 2 days, at the end of the junior doctors' strike, because they're planning to go on strike from the 13th of July until the 18th of July, effectively wiping out a week of elective surgery.
Yeah, it'd be interesting to know exactly what emergency care means in those circumstances. But, I mean, the bigger picture is junior doctors still taking strike action and now this move by the nurses, some good news for the government. What's the reaction to that more broadly?
Well, the reaction from the government is, up until that announcement there from the BMA, the latest we'd heard is that they were really quite elated that certainly when it came to the nurses, the Royal College of Nursing had been planning to once again ballot their members, and with the theory of taking more industrial action days leading up to Christmas. That has now been called off. They haven't reached the threshold to be able to do so. Largely, other health unions had so far accepted the government's latest pay deal, but up until in the last few hours, the nurses had been holding out. They held this ballot. Postal votes landed on doorsteps over the last few weeks. The ballot closed on Friday, and they weren't able to reach that threshold. They needed a voter turnout of more than 50%. They only got 43%. Of that 43% of nurses in England, 84% of them said they wanted to take strike action. But because they didn't meet that threshold, they can't take any further action. It brings an end to any form of campaign by the RCN to hold any form of industrial action. But now the question is, are they going to accept the government's 5% pay deal, which is currently on the table for them and other health unions? The only outstanding union that hasn't said they are happy to take on that pay increase plus a one-off payment is Unite. So RCN very much disappointment from their perspective. They really wanted this strike action to take place, but certainly when it comes to the BMA and those medical consultants, that is going ahead on the 20th and 21st of July.